And if we can make our machine work better, we can help all those patients that are going to come after you. You can be a part of helping some other patient not have to go through a reoperation.
This concept of data, how important is it? Like to the degree of really turning the key on this kind of insight? Like in this case, with the margins, I'm sure, are you feeding of those 2 million images you have, pathology assessed confirmation or lack of confirmation that it actually was in fact positive margin or negative? That takes 2 pieces of data now. It's not just the picture, but it's actually the outcome. And that's what's called outcome data. And I know there's a lot of still kind of fear of people just saying like, well, I don't know if I want to share my data, et cetera. So 2 questions. Number 1, how important and key is data in this process of being able to get better outcomes when it comes to surgeries of cancer seemingly of any kind? And number 2, what are some of the holdups or challenges you see or things that need to be done so that we can kind of get these kind of insights when it relates to data?
The way I think about AI in general, so I'll just step back a moment to give context and dive into the data question. So AI is really, there's 3 components basically when you think about AI. One is the hardware, the NVIDIA computer chip or the Grok computer chip or the hardware that this is all being trained on and then inferenced on, or you train a model and then you use the model. Okay, there's the hardware piece of it. Then number 2 is the algorithms, right? Every day you wake up, there's a new algorithm. There's ChatGPT 3.5 or 4.5 or whatever. And then there's the data. So the hardware, there's a few companies that make the hardware. It's hard to make hardware. It's expensive to make hardware, and that's happening. The algorithms it's kind of a commodity now. Like they're open source. We've seen DeepSeek, for instance, come out of China, being able to be created very, very cheaply and trained very, very cheaply. So the algorithms aren't really the moats that once upon a time they used to be, right? Anyone can go onto an open source software repository and pull an algorithm, and some like amazing algorithms. So it comes down to data, the third component. And this is where the gold is, right? The data. So you can have the best algorithms and you can have a little bit of data, which makes the AI be kind of smart. Or you can have a lot of data, which makes the AI much smarter. Or you could have lesser data, but high quality data, which then allows you to get smart algorithms with much less cost money to get data, right? So much less cost. So that's a framing up the whole thing. Now for us, and I think for healthcare in general, if your ChatGPT gives you a bad answer, yeah, okay. You do a little bit more research, you realize that it hallucinated again. But with healthcare, it's a little bit different, right? So you want to have some pretty high quality data. So our 2 million images, they actually come from about 200 patients. So not a lot of patients, but every patient you get a bunch of images from. And all of that is correlated against pathology, right? So one thing to remember is most of the images you take of a lumpectomy is healthy tissue. So that correlation is pretty, you don't have to label it. Where it gets interesting is where you have to label it. So there's a subset of those images that are that have cancer, right? That the pathologist said there's something there, which we label. So that's key. So what do we want to do? We want to greatly increase our database. That'll do a couple things for us. That will allow us to identify different types of cancer features. The more data we have, the smarter the algorithm, the smarter the same algorithm we have can get. The more data we have, the simpler we could make the algorithm, or there's other modification we can do the algorithm that makes it run quicker. That could make it run, if it's smaller, it could run on potentially cheaper GPUs, right? So the hardware, the whole device gets cheaper in the operating room, which is always very good. The more data we have, you alluded to this earlier, which is spot on. Every person's different and unique. And there are classes of people, right? So with breast, there's dense breast, there's less dense breast tissue, ethnicity plays a role, age plays a role, extent of disease plays a role, whether it's DCIS or IDC or lobular, or mimickers, right? It's not everything's cancer. But the more data we have, the better we can distinguish that. And it's a continuous process. So now, how do you get the data? We have I'm going to call it a camera. We've got our OCT imaging device, our camera, our OCT camera. We're the only ones that can take this picture. So we have to collect all our own data. We can't go and buy it from a database, which means we have to be very close to our hospitals, our surgeons, through them, the patients, to be able to use the data through an IRB. Everything has to be very controlled. But the more we can bring into the database, the better we can get there. What our position is, and we hope, our job is to convince our, partners for this, and I think we'll be successful, is, hey, look, the information we're gathering is, first of all, it's de-identified. We don't care about the person's name. We don't care about their their economic demographic. We do care about their age. We care about their ethnicity. But then the pictures we're taking are, I mean, quite frankly, the inside of your body. I don't know. Me personally, I don't care that much if you take a picture of the inside of my body. It's not my
Right.
face. It's cool. And then the angle that I think is very, very powerful, because you see such community in folks who have gone through cancers. Hey, look, if we can do this, we can make our machine work better. And if we can make our machine work better, we can help all those patients that are going to come after you, and you can be a part of that, right? As it gets better, you can be a part of helping some other patient not have to go through a reoperation, or helping save the system costs later on down the road. And you'll never know those patients, right? Because you don't. But that's a little piece that you can provide. And so, and that's powerful. And that, I think a lot of people connect to that. Hey, if I had to go through this, it's the worst thing in the world I've had to go through in my life. I'd really like to make it easier for others not to have to go through the same thing. So yeah, I mean, just to summarize, data is very important. The more data we have, the better we can get, the cheaper we can make it, the faster we can make it run, and the more precise we can make it. And that has all the obvious benefits.